This is an MRI scan of a 22-year-old student, and we can notice here a tear in the labrum, and we can notice that the head is aspherical, which is what we call a cam lesion, and there's also a cyst here called an impingement cyst. This happens when the head collides with the socket. So how does this collision happen? This is called impingement. This happens when there's a cam lesion or an asphericity of the femoral head or a pincer, and then the head collides with the socket. This causes damage in the articular cartilage and also causes a tear in the labrum. So we are now inside her hip joint, and you can see right in front of us here is the femoral head to the right, the acetabulum to the left, and the labrum up there on the top. This is a tear in the labrum, and we can see that the labrum is unstable. It's not attached to the rest of the articular cartilage. You can look at the diagram on the right to see where exactly in the hip we are pointing to. You can see how the labrum is moving when I probe it. If you move a bit more lateral to the labrum, you can see that this is non-damaged, or this is intact labrum, still attached to the articular cartilage. This is the back of the hip, the posterior part of the hip. There are some changes here and some damage here, but the labrum is still attached to the articular surface. This is the rest of the articular surface of the acetabulum, and to the right there is the articular surface of the femoral head. And you can see here this is called the ligamentum teres. This is the band that attaches the head to the socket, and this is still intact in this patient. Now this is the labral repair that we did using 2 anchors. You can see the labrum now is no longer moving around, and it is stable, attached to the rim of the acetabulum. This is when we relocated the head back in position. You can see that the labrum is forming a seal around the femoral head. And this is the main function of the labrum, to make a seal around the femoral head. This here is the impingement cyst that we saw on the MRI scan. The head of the burr, which is the instrument that we're seeing right in front of us, is around 5 millimeters. So you can see that this synovial pit, or this impingement cyst, is around 4 millimeters or so in depth. We're now burying out the cam lesion, or the extra bone that caused the impingement between the head and the socket. We're not doing this just around the synovial or the impingement cyst. We're doing this all around the head, creating a slope downwards to prevent further impingement between the head and the socket.